everyone, my name's Hallie Huber, and I am so excited to host the 5th episode of WIT Talk here in the Spark Studio. Today I will be talking with Jessie Tillman, a local physical therapist, and our 2024 winner of the Women in Tech toBE Fund Scholarship for Entrepreneurship for her product No Tiptoe. We will discuss Jessie's career in depth as well as the influence entrepreneurship has had on her recent career. Let's get started. So, how are you, Jessie? We're so excited for you to be here with us in the Spark Studio.
Yes, I'm excited to be here and talk a little bit more about my product.
Yeah, okay, well, let's go ahead and just dive right in. So, Jessie, why don't you tell me a little bit about your educational experience throughout high school and college? Did you know, for certain that you wanted to pursue a career in physical therapy from the start?
Yeah, so I actually knew I wanted to be a physical therapist since I was in high school. I was a competitive soccer player, and in my junior year, I got injured and I had to do PT myself. I really loved participating in PT, and I had a big interest from there on how to help heal the human body and how cool it is to be a part of helping people recover from their injuries. And so
yeah, it just sounds like such a great start to getting into that.
it was cool to experience it firsthand, because a lot of people don't figure out that they want to do PT until they're in college and they kind of don't really get on the receiving end. So it was cool to have it help me so much and then want to go into that field.
Yeah, I'm sure that experiencing it yourself was a great way to kind of get involved, because I know that a lot of people, when they're starting off their college journey, and they're like, I have no idea what I want to do.
Yeah.
It's such a daunting thing to think about.
Oh, yeah.
So already knowing from high school and from your experience is a great thing.
Yeah.
So why don't we kind of dive into the pursuit of higher education? I know that physical therapy school takes years to complete. So how did you stay motivated during your pursuit of higher education?
Yeah, PT school takes around 7 years to complete. They
Wow.
have made it a doctorate degree, so it's a very hard curriculum. We've got, neuroanatomy and pathology and pharmacology, so it is difficult. I knew that physical therapy was exactly what I wanted to do, and I think that when you're studying in the field that you're meant to be in, the classes interest you more, and you really want to learn about how to help people. I didn't want to just get through classes and get my degree. I wanted to really understand it so that I could help people even more. And it was definitely hard at times, for sure, but you just have to keep your eye on the prize and keep pushing and knowing what the end goal was.
Yeah, it sounds like your will to go above and beyond instead of going through the classes and going through the motions. I'm sure that really helps set you apart and prepares you for that real world experience that you have to go through actually working as a physical therapist.
Oh, yeah. I mean, it's just next level. And it really was such a difference from undergrad, just checking off boxes. And you're like, no, I really want to make sure I got this so that I can help these people. And it was cool to kind of see that change in my interest as well.
What made you realize that you wanted to pursue a career in such a people-centered career? Because I'm assuming that physical therapy, obviously it takes a lot of years to understand the methods and the treatments, but once you're actually out in the field, it's very much people-centered, people-focused caregiving. And so what made you realize that?
Well, I've always loved working with people. Both of my parents, ironically, are engineers. And so I actually think I got a little bit of their engineer genes because I loved math and physics in school. But I knew that I just had to be in a people interactive job. I love talking and connecting with people. And I have a really big heart for having the ability to help people get better. And that's just such an amazing gift to heal, and it really is an honor to work in this field and just have a lasting impact on people. I think that's probably the biggest reward. And in pediatrics, you aren't just helping kids get back on their feet. You're changing the trajectory of their life and improving their prognosis for the rest of their life. So that's huge.
Yeah, I'm sure. And especially working as a pediatric physical therapist, I'm sure that that's totally different than an approach of working with adults and teens. What's the difference?
Yeah, so I actually started out in an outpatient ortho job with adults, and it is different for sure. Knowing that a kid does not have that ability yet and you're helping them gain that ability for the first time, whereas with an adult, you're working on helping them get back to their lives. They've known how to do these things and they've lost that ability and now they're coming back to it. And so to work with kids, you know that like they didn't have that ability to walk, but now they do. And you're making a lasting impact. It's huge. And obviously there's rewards in both, and every PT has their own, field that they love. But I just that was huge for me, and I really enjoyed that part of pediatrics.
With pediatrics, I know I would get emotional and stuff.
I cry all the time. It's so cool. I mean, it's just awesome. You see, like, the mom is there with you or the parents, and you see a kid take their first steps. That is like something the parents will remember forever, but so will I. I mean, it's amazing. So
yeah, I know how big of a deal that first steps are for most parents. So getting to experience that with them is definitely a great kind of bond. And I'm sure that it takes a very special kind of person to work with children as well, of being able to connect with both the kids and the parents. It's probably a lot more work than just working with adults by themselves.
Absolutely, it is. Yeah.
Okay, well, why don't you walk through your career journey for me as a physical therapist? I know we kind of got a little bit into that you started off in just general physical therapy and then kind of focused on pediatrics, but walk me through a little bit more.
Okay, so in PT school, you have to go through what's called clinicals, where you choose a current PT clinic or hospital, and you shadow an actual PT for a few weeks or months to get experience, but also to figure out which setting you really enjoy. And I was actually scheduled to do my clinical in Huntsville, but at the last second, it got canceled, and I got reassigned to Children's of Alabama in Birmingham, which is amazing that I got that as a backup, because it is like the pinnacle of pediatrics in Alabama.
Oh, for sure.
And it was the most amazing place to be, and I learned so much while I was there. But that's also where I found my passion for pediatrics. So I started, like I mentioned, working with adults, and I really enjoyed that experience, but I knew my calling was working with kids. And so after a few years, I got the opportunity to work at a pediatric clinic, and I haven't looked back. It's just been awesome to have a huge impact on these kids, and it's an amazing gift to be a part of it.
Yeah, I'm sure. I know that having that sort of change of, plans of, oh, I'm going to be in Huntsville, and then boom, got canceled, and having to readjust. I'm sure that took a lot, but I know that in the end it, created a new passion for you and into going into physical therapy. So that's so exciting to hear.
Yep, it was a intervention type thing. It was like, okay, something happened and here I am. And now looking back, it's like, okay, that was what was supposed to happen.
Right. Being able to pivot is one of the biggest things, I think, of just one's mental strength.
Absolutely.
Being able to, quickly just change on their feet. So that's exciting, and just I respect you for that, basically, being able to do that and make the most of it. What would you say is one of the most valuable lessons you've learned through your career journey so far as a physical therapist, or specifically in pediatrics?
Well, a big lesson that I've learned in pediatrics is that no kid is the same. And it's easy in the medical field to see certain symptoms or see a presentation or even have a diagnosis, and you put kids in this certain box, and that makes you assume certain expectations or prognoses. But every single kid that I have seen is different, even if they have the same diagnosis. And so kids are just really resilient, and they have so much neuroplasticity that they're capable of so much. And so I've tried to go into each different case and strive to help them get as far as they possibly can. And I've been able to help these kids achieve more than what was expected of them, because I feel like I saw their potential rather than their limitations. And I think that's one of the biggest things in pediatrics that you have to learn and adapt to.
Oh, I'm sure. I'm sure that's such a big change from what you learn in PT school versus the real life. Kind of like you said, that engineering or mathematic mind, or scientific mind, I guess I could also say, of being able to see that, okay, this sort of treatment doesn't work. How can we pivot to be able to help accommodate this kid?
It's crazy, because you get two kids that, for example, have cerebral palsy, and it's such a wide spectrum. of a disease that you read on the internet. And this is another thing for parents. They go online, they say, how does CP affect your child? Some kids are in wheelchairs, some are on the football team. It's such a wide range. So to not limit kids and to try to just meet them where they're at and get them to the next level, that's the goal. And I think that just going above expectations, obviously you have to be realistic with your diagnoses, but just trying to make the most of their prognosis is huge.
What all does a career in physical therapy, specifically in pediatrics, entail?
I think one of the biggest keys of being a good PT is being empathetic. It can be really easy after seeing several patients to just dive in and start trying to get them to the next milestone. But remembering that this is an obstacle that they have to overcome, whether they have a life expectancy of only a few years or they're just slightly delayed, trying to be empathetic and give them grace is huge. And you kind of touched on this earlier. With pediatrics, you end up giving the parents therapy as much as you do the kids.
Oh, really?
Yeah, to let the parent know that what they're going through is adequate and it makes sense, and let them know that we're going to get through this and that they can also give themselves grace. That's huge for these families. A lot of these parents have guilt for something that might have happened in birth or after birth with their child's diagnosis, but helping them get through that guilt and seeing the miracle that their baby is here and that we are going to give them hope and we're going to help them accomplish what they're able to accomplish. That's a game changer for these parents. And I truly believe that God does not give these babies to parents that can't handle it, because these are the strongest parents I've seen. And being there with these parents and understanding their concerns and helping them through this is a huge part of pediatric PT. Another big key for pediatrics is being innovative. Like you talked about, new techniques and methods of treating kids are being discovered every single day. So you have to be willing to try new things, be creative in your treatments, and push the limits of what's possible for these kids. I believe that's really what helped me create my product.
Yeah. Why don't we actually move into the theme, which is entrepreneurship? I know you mentioned something about you have a product that you are launching. But first, let's dive into our theme of what do you think entrepreneurship means to you?
Well, there's the obvious definition of taking a risk and starting a new business or having a new idea that disrupts the current market. But really what I think about with what I have wanted to accomplish, it's to change the standard of healthcare and push the boundaries of limited and outdated treatments. It wasn't easy coming up with something new, and these other treatments have been in use for decades. But I just knew that there had to be a better way, and I was willing to challenge the current treatments and come up with something better.
It takes a lot of inner strength to be able to do that, because that is a bold thing to do, of realizing that, hey, there's probably better methods out here that can treat this certain condition, and just being able to have the creativity, like you said, to be able to realize that, not only that, but to come up with a solution as well is a very big thing. So why don't we actually dive into what your product is? No tiptoe?
Yep, my product is for people that walk on their toes. It's No Tiptoes, the name. Studies show that currently 24 million children in the U.S. alone are walking on their toes. And while it seems harmless, over time, walking on your toes can lead to serious complications such as tight muscles, deformed bones, stretched ligaments, decreased balance and motor skills, and not to mention all the social stigmas that looking different has on children. No Tiptoe is a discreet and effective treatment for toe walking that helps kids get off their toes without the trauma and pain of the other treatments. Many kids that walk on their toes have sensory processing disorders or autism, and this is part of why they want to go up on their toes. They like that sensory input through the balls of their feet. So my product actually helps address those sensory needs in order to help those kids as well to get off their toes. One of the things that I think makes my product unique is that usually with physical therapy, you have to go through several times and really participate for several weeks to get to see a result. And so This insert stops toe walking immediately upon insertion. I had a patient that was 15 and had been walking on their toes for her entire life. And I put these inserts in and she stopped immediately. So it really has been cool to have those immediate results because that's very different than anything else in PT, really.
Yeah. Wow. It's interesting, like you were saying, it's not just that there's no reason behind toe walking. Like you said, it's multifaceted of wanting to get that sensory sensation. And also I can understand that the complications and stuff, while it may be, great to have that sensory input, those complications can be lifelong lasting.
Right.
And so being able to have a product that doesn't require harmful or just painful treatments, but also prolonged treatments, just like physical therapy itself, and being able to see the great and immediate impact, like you said, of the 15-year-old, that is so exciting to see just in the early stages. So
Oh, yeah.
I'm so excited for you.
It's really cool. And yeah, I mean, there's so many different causes of toe walking, really. And so to address one of the main causes and really just help them, this insert basically, it gives them that pressure through the ball of their foot, like they're toe walking, but they're not. And so it really just helps to address all different types. So there's other reasons for toe walking. It can be idiopathic, and I've seen it work with all of the types of toe walking. So that's been really encouraging. Yes.
Well, why don't you tell me a little bit about what inspired you to create No Tiptoe and what makes you so passionate about it?
So my motivation really is to help introduce products and ideas that can help people and keep them from going through these other painful and ineffective procedures. I found a lot of my passion is basically from seeing these ineffective treatments and deciding that I'm not going to sit back and wait for someone else to come up with something better. I'm going to figure it out, and I'm going to figure out a better way on my own. I remember sitting in my house and trying several different ways to help this problem and coming up with something that worked so well that other schools and clinics were asking for more of my product. And the other thing that inspired me was seeing the other options that these kids had. So the current procedures that are available for toe walking are casting both legs for several weeks to months at a time.
Oh, God.
Using expensive plastic orthotics to keep them from going on their toes, but this limits their range of motion and their activity. Botox injections to deaden the calf muscle, and even surgery to cut their Achilles tendon.
Oh, God. That sounds invasive and just painful.
It's traumatic for these kids. I mean, I don't even want to go through those as an adult, and I cannot imagine. I mean, even the less invasive one of casting, you're going to look so different. These casts go almost up to your knee, and you can barely play in them. They're dynamic, so you're supposed to be able to walk in them, but it's just a lot for these kids. And yeah, they're not only painful, but they're traumatic, and there's actually a high recurrence rate of toe walking after going through all of that. So I believe this makes my product stand out as the obvious choice rather than jumping to these extremes.
Yeah, and I'm sure that with those methods, like you said, like the casting and stuff, even one of the less invasive procedures, I'm sure that limits that sensory input, which can cause, a lot of just discomfort. And so I'm sure that just having a product that can treat as well as give that sensory input is just amazing. Why do you think that there hasn't been any sort of new inventions to help toe walking?
Well, honestly, I think that as physical therapists, we learn what the current treatments are, and a big push with toe walking has been to treat weak muscles and try to get the right muscles to fire, which is the logical way to treat toe walking. And that, as a PT, that makes sense to me. That's a good approach. Mm-hmm. And I've also implemented this approach, but what I've found is going to PT once or twice a week for 30 minutes and then having the kid walk on their toes everywhere outside of therapy, it's just not as effective. This is especially difficult for our nonverbal kids or autistic patients who can't follow verbal commands. So
I see.
It gets frustrating for parents, get off your toes, but also like if you have a nonverbal patient, you can't say that to them. That doesn't compute. And so I found that my product helps break the habit from the beginning, and this, along with those PT techniques, can be the key for helping these kids make lifelong changes. A few other options that have come up for toe walking were made from people who I don't believe have a background in physical therapy, which can be dangerous, or biomechanics. So they don't understand the causes or the reasons behind the toe walking, which makes those products more ineffective as well.
Oh, I see. So especially not having that sort of background, that kind of limits the view of effective treatment. So being able to have that background yourself, I'm sure, is extremely beneficial. How do you think that No Tiptoe can make a difference in that gap of treatments?
There is an obvious answer of how it is more effective, less invasive, and much easier than the other treatments. But my hope for this product is that it will challenge other PTs to not accept these ineffective treatments, but inspire them to come up with new and better ways to treat the myriad of pediatric conditions, to stop watching kids go through these surgeries and the traumatic experiences and find a better way. I've started to come up with more ideas and ways to treat other common conditions in pediatrics, and I'm just excited to see how this product and others are able to change the game of pediatric PT.
Yeah, like you said, it seems like it is a very much less invasive procedure or solution. And so being able to have that as a new option, I'm sure, is a great way to fill in that gap, not only fill in that gap, but to be able to just eliminate that gap in a way. So what do you think that your journey of entrepreneurship has looked like so far?
It's been fun. I'm excited to see where it goes, and it's inspired me to keep pushing the boundaries and keep creating. At times, it's been difficult as a young PT who's not even in her 30s. I've been underestimated, but as soon as I describe the product, why it works and how it works, and the results, I'm taken more seriously, and I think it's just been really empowering and very neat to be a part of something like this that I really believe could change the standard of treatment.
Yeah, I'm sure that it's probably frustrating to be, like you said, since you are still young, and I'm sure that that's frustrating to be not taken as seriously. So being able to have this product to be able to be like, no, I know what I'm talking about, and this is an effective treatment. I'm sure that being taken seriously, especially as an entrepreneur, is something so refreshing to be able to have.
And to know that there's a need. When I talk to other PTs, they're like, oh, this is great. This will be really awesome to have. And so to get that feedback and that encouragement from other people in my field has been huge too, to help me with my confidence and just know, okay, you're doing the right thing here.
Yeah, I'm sure that that's really reassuring to know, and especially knowing like what you said earlier about the 15-year-old and stuff who had, great results just immediately, being able to see that, and also the affirmation from your peers. This is a great treatment and, can be implemented well, I'm sure is extremely just refreshing to hear.
Yeah.
Why don't we go into your goals, short term and long term, for No Tiptoe? What would you say that looks like for you?
My short term goals are for my product to get its name out there and start to be accepted by other clinics, practices, and families, to get the word out that kids can have an easier and less traumatic way to treat toe walking. My long term goals are for No Tiptoe to be the standard of treatment for toe walking, and to have this alternative way of treatment to inspire innovation with other pediatric conditions that could be treated in a better way as well.
Yeah, I'm sure that being able to get the word out there is a great thing to have. We're so excited that you were our 2024 Women in Tech toBE Fund Scholarship winner, sponsored by Cigna and Link. And so I'm sure that that's just one great step into being able to gain recognition and support for your product. So why don't we go into any advice that you might have for other women who want to pursue entrepreneurship, either as a full-time career or as a side hustle?
I would say if you are questioning why there isn't a better way, or if it feels like you have a good idea but you don't know how it would go, I would say go for it. I felt those same things. I was making my product by hand with materials that could be found in any clinic. I didn't even plan on selling it or making a business, but when I found how effective they were and the demand for something better, I felt the responsibility to take it to the next level. Studies show that over 80% of pediatric PTs are women, especially when going up against male doctors or surgeons who've been performing these treatments for years. It can be intimidating. But if you have the passion to change things for the better and you go in it with confidence, then you can make a huge difference. You will not regret taking that chance, and it could just be the next big breakthrough.
Yeah, like what you were saying, just going for it and having confidence in yourself to be able to pursue that passion and desire of wanting to realize that there is a gap and have the guts to say, you know, I have a solution. And I'm sure, like what you said, it is totally daunting to be able to stand up and say, hey, these treatments, they're just not great, especially after they've been established for so long. I'm sure that that's kind of scary. I'd be scared in a way too. Yeah. So being able to have that confidence, like you said, is extremely important.
It's key.
Yeah. Okay. So let's move on to the next question of why do you think that more women should get involved in entrepreneurship?
I think that more women should get involved because it is important to make these strides and improvements in our fields, especially when it is a woman-dominated field. It's important for us to stand up and take on that role so that we can not only make an impact, but also encourage other women to take on that role and be confident while doing that.
Yeah. Yeah. Entrepreneurship is the way that we can continue to move forward and challenge previous ideas, which is something that I remember learning in science class of being able to see that the previous methods are ineffective and being able to challenge that and having that mindset of being willing to challenge the previous methods is something that is especially important. And like you said, in such a women-dominated field, approaching it from the encouragement and wanting to empower other women is so important. Okay, so how do you think that you have been supported throughout this entrepreneurship process of No Tiptoe?
Well, I feel like I've really been blessed in the way that my community has been able to give me resources and ways to kind of move forward. Obviously, as a PT, I don't have much background in business or entrepreneurship. So to have companies like I2C at UAH to help me with learning, okay, here's what you need to do next, and here's what this is going to look like. The small startup companies that I've been able to work with who have helped me design my product and create my website, I'm very thankful for them and their support. And then also, of course, the Women in Tech toBE Fund scholarship sponsors, Signalink, that they have been able to help me in this process. Like I mentioned before, I'm a young PT, and so to just get support from this community, I feel so thankful and just blessed to be given these opportunities, because I know for sure that without them, I would not be able to really get this thing off the ground. So I've just been extremely supported in this process. I'm very thankful for that.
We're so excited to be here to support you as well. And I personally am so excited to see the amazing results that your product will have in the future. I have full faith in you.
Thank you.
You're welcome.
Very much.
Okay, Jessie. Well, that's all the questions that I have. So how can people reach out to you or get involved in No Tiptoe? Do y'all happen to have a website or social medias or anything?
Yeah, so we have both. We've got a website where you can learn more about the product, how it's made. We've got a cool little 3D printed speed up where you can see actually it being created and also obviously order the product. So that's available on our website. And we also have social medias, because a lot of what our product is involved with is the product itself as well as education for the parents. So learning how this works and why it works, as well as for the clinicians and the pediatricians that are using this product as well. So we've got all of those.
Yeah, well, awesome. Thank you so much, Jessie, for joining us on this Women in Tech WIT Talk podcast, episode 5. And stay tuned for the next one. Thank you so much. Bye-bye.